Good morning, everyone. We're starting to have a couple of people joining us in the room. We're going to give it just another minute or so people can settle in and gather. We'll be starting shortly. Welcome to all of the early birds. I'm always impressed when people show up right on time for a Zoom call. All right, it is 8:01. We're going to give people just another few seconds to gather. We've got a lot to pack in today, so I don't want to linger too long while we wait. All right, let's get started. Good morning. Thank you everyone for joining us. Thank you to those who are still gathering. We are going to start. I'm Christy Ariano. I'm Managing Director of Marketing and Communications here at the Colorado Health Institute. And welcome to our monthly Eggheads webinar. Today, we're going to be reviewing the 2022 legislative session, which ended just a week ago. We reserved times for questions and discussion at the end of the presentation, but please feel free to drop your questions into the Q&A box at the bottom of your screen at any time during the presentation. Our colleague, Guadalupe Solis, will be monitoring the Q&A, and she'll be providing resources and answers throughout the session. We might also ask you to raise your virtual hand so we can unmute your audio and you can ask your questions live. Finally, we've been doing these Eggheads breakfast webinars since early in the pandemic, and we've got a special treat today. It hasn't escaped our notice that it's National Egg Month, which I know you all look forward to celebrating every year. So at the end of today's session, we're going to pick one person who registered today, and that person is going to receive breakfast for their office. So stay tuned for that. As a brief introduction, the Colorado Health Institute is an organization founded on a belief that good health policy leads to a healthier Colorado. Every day we bring research, insight, and expertise to leaders across our state because informed decisions lead to better health for all. We're an independent nonprofit organization. In addition to providing a public-facing portfolio of work that is funded by philanthropic supporters, we consult with organizations, including community groups, hospitals, payers, government agencies, and foundations to provide not just analysis and data, but strategic planning, facilitation, complex modeling, evaluation, and strategic communication. I'm always happy to connect, as are any of my colleagues, if you'd like to learn more about how CHI can support your work. 2022 is a milestone year for CHI. The team here has given a lot of thought to the past 2 decades in health policy in Colorado and the work we need to do in the coming years. CHI has been involved in so many aspects of health and healthcare, and we've always stayed true to our mission of working to make Colorado a healthier place. As we start our 3rd decade, we're bringing a more intentional focus on 3 aspects of health that are pressing, urgent priorities. When we survey the landscape, we believe that there are 3 policy areas that must be addressed and that must be addressed now. We've got a small window of time to get these right. You're going to see a sharper focus from CHI on systems of care, behavioral health, and climate and health. We'll review legislation from each of these 3 areas today. And now I'd like to turn it over to this morning's presenters, Joe Hannell and Allie Morgan. They're both directors at CHI and both have extensive experience in legislative analysis, so you'll be in very good hands for the next hour. Joe joined CHI in 2014. In fact, he joined 8 years ago today, and he works in communications. Prior to that, he covered the state legislature for 9 years as the state capitol correspondent for the Durango Herald. Allie is also coming into her 8th year here at CHI. She oversees our annual research agenda and directs our legislative services portfolio. And with that, I'll turn it over to Joe.
Well, thank you so much, Christy. We have a presentation in three parts for you today. First, we're going to be looking at the national scene and where Colorado fits in. And the takeaway from that is that we've really become two countries when it comes to health priorities and health policy, with a few notable exceptions like behavioral health. In the Colorado legislative session that just ended, we saw health bills be among the highest profile and the most headline grabbing of the session. And then finally, the last session was going to be about the American Rescue Plan Act, this huge federal stimulus that came to the legislature that last year, but that was largely appropriated this year. And we're going to be diving into that in some detail at the end of the presentation. So first, let's look at national trends before I toss it over to Allie to look at what happened here in Colorado. Allie and I have been doing this legislative recap presentation in one way or another at CHI for 7 years now. And this year, we wanted to change it up a bit by starting with some of these broader trends among the states so we can see where Colorado fits. I'm going to show you a series of maps that show policies in 5 areas. First, COVID vaccines. Closely related to that is public health authority, then abortion policy, behavioral health, and finally, housing. What you're going to see is the emergence of a red state, blue state split in how we deal with public health. The underlying dynamics have been there for quite some time, but the pandemic really accelerated the divergence. You'll also see some areas of common priorities, namely behavioral health and housing. And those 2 areas show that Colorado is hardly alone when dealing with these 2 of its biggest problems. So let's start with the nation's governors and their state of the state addresses. We took, I think, 47 or 48 of these speeches. A few states didn't have them this year, and fed them into a word cloud generator. And this is what it put out. The biggest words, which mean they're the most frequently used, are words of optimism, like you see right in the middle there, people can. That's kind of what you'd expect from a state of the state address. When it comes to issues and policies, though, I noticed 2 things. One is that our nation's governors are done with COVID. I highlighted the word pandemic in gold so you can see it hiding out down there on the Florida Panhandle. The word COVID didn't even make the list. In fact, the governors of the countries collectively said the word Idaho more than they did COVID in all of their state of the state addresses. This tells me that they've been dealing with this pandemic for a couple of years and they just really don't want to talk about it anymore. Whether the pandemic is done with our nation's governors and the rest of us, that's a topic for another webinar. Second takeaway here is that health was mentioned a lot. You can see it up there in the Pacific Northwest. This can include the health of the economy, to be sure, but governors like talking about the concept of health. It's optimistic, it resonates with people, it's very personal. And so keep that in mind. I assume most people on this call are in some sort of health-related field, and what you do is important to people, and important people want to talk about it. So keep that optimistic message in mind to temper the effect of the next couple of slides here. Let's start with COVID vaccines because they've been highly polarizing. These maps look at 3 different policies. 2 are pro-vaccine policies. One of those policies would be to require state employees to get vaccinated or tested regularly, and another to create a state-sponsored smartphone app that people can use to certify their vaccine status. Colorado's done both of these. These are states that have done one or another or both. But now let's look at an anti-vaccine policy banning so-called vaccine passports. The states in red here have banned state entities and or private businesses from requiring vaccination as a condition of employment, to patronize a business, to get public services, anything like that. Only 4 states haven't passed a pro or anti, one of those 3 pro or anti-vaccine policies in the past 2 years. And Virginia, swing state as it is, has done one of each. So this map isn't a perfect match, but it sure looks an awful lot like the 2020 presidential election map. And it just shows how highly politicized along traditional partisan lines the pandemic has become, or did become. Closely related to the pandemic is our second national topic: public health, infrastructure, and authority. Our public health agencies have been severely taxed by the work they had to do from COVID and the backlash that it produced. So here's a map created by Kaiser Health News that tracks the resignation or firing of local and state public health officials, locals in blue, state officials in orange. There are more than 300 of them who've resigned or been fired since the start of the pandemic. And Colorado actually appears to be somewhat of a hotspot here, especially in the rural counties along the Continental Divide and the San Luis Valley. So what are states and governors doing about this? Well, only 15 governors mentioned public health infrastructure in their address, in their state of the state addresses. Red state legislatures have taken steps to cut back on the power of the executive branch or public health authorities to do some of those non-pharmaceutical interventions like imposing mask mandates or closing schools and businesses. Blue state legislatures, on the other hand, have taken some smaller steps to bolster the public health workforce. Overall, though, we didn't see a whole lot of major legislation that was game-changing in favor of public health. So instead, I'm just going to pick out a few notable examples of policies among the states. First, Kentucky and Tennessee have said churches can't be closed during a public health emergency. Utah said its local public health departments can't issue public health orders for state buildings, which is probably means that state legislators didn't like being told by the Salt Lake City Health Department to wear masks. Texas has said the state can't limit certain medical procedures during a state of emergency, but Texas also passed some pro-public health provisions, including checks, medical checks or welfare checks on medically fragile people during a state of emergency. New Jersey set up back in 2020, set up an emergency operations center just for its long-term care facilities to deal with the COVID crisis. Thought that was a pretty innovative idea. And Illinois is this year decided to create a Healthy Illinois survey, which sounds an awful lot like the Colorado Health Access Survey. So if you know anybody at the Illinois health agencies, send them our way here at CHI and we can show them how it's done. Now, here's where you really see the red state, blue state divide. It's over abortion. Of course, the Supreme Court apparently is about to overturn the Roe v. Wade precedent, which means states will control abortion policy. So let's go through 4 maps. First, starting with states that have existing abortion rights on the books. Next is states that passed or enhanced abortion rights in their legislative sessions this year. That includes Colorado. Here are states that that passed new restrictions this year, and then finally states that have some sort of a so-called trigger law, which would take effect. It would roll back abortion rights or ban the procedure entirely if Roe v. Wade is overturned. Put it all together, and you have what people have been calling an island or a peninsula in the Mountain West of Colorado and New Mexico, being the only places in really from west of the Mississippi over to the Pacific states, where abortion is likely to be legal in the next couple of years. That means probably there will be a large demand on Colorado providers. Our fourth national trend is behavioral health, and this is where we start to see some agreement regardless of politics. If we'd done a map of states that expanded behavioral health in Medicaid in the past 2 years, every state would have been colored in. And most states, similarly, in the past few years, have adopted new crisis service initiatives like mobile crisis teams, crisis hotlines, things Colorado has been working on in the past decade. But there's one topic where politics does appear to be continuing to drive policy, and that is fentanyl, which played a starring role in Colorado this year. Fentanyl, brief background, it's a highly potent opioid that has very legitimate uses in the hospital, but also is sometimes or frequently illegally sold on the black market and cut into drugs that people might not even know they're getting fentanyl. This map shows where governors discussed fentanyl in their state of the state addresses. And when I looked at the language, it was usually in a law and order context, including Governor Polis here in Colorado, who said that because of the increase in fentanyl overdose deaths, this is a case where, quote, the swift arm of justice is the best solution. There were Republican governors who were even more strident, and they discussed fentanyl in the context of deploying their national guards to the Mexico border, including states like Idaho, Ohio, Florida, Tennessee, that are really nowhere near the Mexico border. And really, you're seeing this issue you're seeing fentanyl get wrapped up in national electoral politics here. Colorado did pass a bill to increase penalties for fentanyl possession, but it also had a lot of pro-public health measures in it. Allie's going to go into detail on that a little bit later in a few minutes, so sit tight for that. And finally, the last concept in the national context is housing. No red state, blue state divide here either, just a whole country struggling to deal with rising homelessness and an unaffordable housing market. So in 2022, 20 states so far, there may be more coming, have enacted laws, new laws on housing, including affordability and renters' rights, most commonly. And 11 states passed bills to address homelessness. Colorado did each of those, mostly using its American Rescue Plan Act, or ARPA money, to help people experiencing homelessness or try to improve housing affordability. I'll talk a bit more about that at the end of the presentation. But for now, I'm going to turn it over to Allie to take us through some Colorado storylines.
All right, thank you, Joe. And good morning, everyone. It is nice to be with you all virtually. So as Joe mentioned, I'm going to turn to the state level now and talk about what happened over the last 4 months in Colorado. So the session began this year, I think, with sincere hopes of things feeling more normal than they had in some time, but it wasn't always easy to stick to the content. The Omicron wave and continuing partisan disagreements over various COVID behaviors, things like whether or not to mask on the House and Senate floors, was certainly a challenge, especially in the early weeks as legislators adjusted to being back together, as was the addition of election year politics. In case you haven't noticed, there's an election coming up in November. Despite all that, though, I think the session did end up feeling much closer to business as usual than the prior 2 years, and that was a welcome change for a lot of folks who spend a lot of time at the Capitol. Before I jump into some health policy themes and bills from the year, I just want to start with a few numbers. So there's a lot going on in this graphic, but this is looking at the total number of bills that were introduced in recent sessions and the passage rate of those bills in addition to party control, whether it was split party control or in the last 4 sessions, single party control of both chambers. As you can see on the far right side, those are preliminary numbers from this year, 657 bills were considered, which is the most since back in 2018. The bill passage rate was 78%, nearly as high as the year prior, even though there were more bills introduced. So far, at least, we have 0 vetoes from Governor Jared Polis. However, Governor Polis had a whole bunch of legislation fall on his desk just a week ago when the session concluded, and so that may change. I believe we had 4 vetoes last year, so that's something we are still keeping an eye on. And notably, 50% of bills were still undecided with 2 weeks remaining in the session this year. There is certainly always a big crunch at the end. That's nothing new. But for various reasons, there was just more left to do in the final days of the session this year than normal. And so we are still sorting through all of those final results and amendments, as I'm sure are many of you. Next month, we're going to publish CHI's annual legislation and review report, and that will include more detail. But we have some initial takeaways and thoughts that we would like to share today. And that includes 5 health policy themes that we would like to spotlight. So those are about efforts this year we saw to reform behavioral health, to support family planning and early childhood, to evolve our systems of care, reduce our healthcare costs, and finally, a look at how public health was really forced to choose its battles this year. So I'll talk a bit more about each of these. First is behavioral health. And so as Joe mentioned, behavioral health has really represented an opportunity for strong bipartisan collaboration in recent sessions. That was on full display this year as Colorado legislators came together to prioritize and fund behavioral health initiatives in the wake of a devastating pandemic that, as we all know, has pushed substance use and mental health challenges to new heights. And the fentanyl epidemic has really dominated headlines here. Here are just a handful of the ways it has shown up in media coverage of tragic events in recent weeks and months. And Joe talked about what a problem this has been around the country, and elected leaders were determined to do something about the problem here after more than 900 Coloradans lost their lives from a fentanyl overdose last year. Our legislators wrestled with this basically the entire legislative session through House Bill 1326, which passed on the final day last Wednesday. One of the year's most watched bills, this had bipartisan sponsorship and support, but it also created rifts within parties and between members of the House and Senate, for example. This bill passed, but many advocates are characterizing it above all else as a setback for harm reduction. The bill increases the criminal penalty for possessing and dealing fentanyl to a level 4 felony. Governor Polis, as Joe talked about, pushed for harsher penalties as a way to crack down on the illicit substance this year, but many argued that criminal penalties do not deter addiction, citing examples like the failed war on drugs in the 1980s, which caused more harm than good. Further, criminal penalties do not deter unintended consumption among users who are increasingly at risk of acquiring drugs that are laced with fentanyl, not to their knowledge. However, I think lost in much of the coverage of this bill is all these other aspects included in it, including things like $40 million for prevention and education and treatment efforts from a grant program that's new to bulk purchasing of naloxone. So I think there are pieces in here that are really encouraging for public health folks for treatment, et cetera. But I think the harm reduction and criminalization piece really did become a major story. Next, House Bill 1278 officially establishes the new Behavioral Health Administration within the Department of Human Services here. This is a big undertaking, and it was appropriately a really big bill at about 300 pages long. I'm sure there are folks on the webinar today who have read it. This bill charges the BHA with creating a coordinated, cohesive, and effective behavioral health system in Colorado, which is really an attempt to bring order to a system that has long struggled with fragmentation. The BHA will oversee most programs that have been under the Office of Behavioral Health, though a few things like community prevention will move over to CDPHE, our public health department. This bill passed the Senate unanimously and the House with more limited bipartisan support. And finally, on the behavioral health front, we wanted to talk about this issue. For months, journalists with the Colorado News Collaborative have been reporting on problems with the state's mental health safety net system. Thanks to whistleblowers and investigative work, concerning problems with community mental health centers have been coming to light. The takeaway from this reporting is that Colorado's 17 regional community mental health centers are, quote, failing many Coloradans and operating with very little state oversight. Problems have ranged from non-compete contracts with the state to a decade of staff admitting to falsifying patient records. And so Senate Bill 106 was a response to this issue. It addressed conflicts of interest by increasing review and oversight of managed care organizations by HCPF and CDHS, the Department of Human Services. The bill's fiscal note mentions an estimation of 30,000 unique contracts that will need to be assessed. And on a related note, House Bill 1214 requires mental health and substance use crisis services, including walk-in and mobile centers, to meet minimum regulatory standards to ensure they can provide the types of behavioral health care that Coloradans need when they're in a crisis. And a key clarification in this bill allows these kinds of centers to provide services to youth without consent from a parent or guardian. Moving on to the second theme we're spotlighting today, this is really about family planning and early childhood supports. So a great deal of energy has been devoted to policies around these two really formative periods of life, pregnancy and early childhood. The result is that Colorado has both codified and expanded supports for family planning and for families with young children this year. So as Joe noted, House Bill 1279 was introduced by Democratic legislators to protect abortion rights here in Colorado. The bill codifies the right to make reproductive health care decisions, including those related to abortion and to things like contraception, without government involvement. So thanks to this preemptive measure, which passed on a party line vote in both the state House and the Senate, Colorado is now a stronghold for reproductive autonomy, and we just think that that makes it one of the session's most important and notable bills, even though it doesn't really change the way that things are happening in Colorado today. Next, I wanted to mention House Bill 1289, known as the Cover All Coloradans effort. This bill extends health insurance coverage to pregnant people and to children without documentation. It creates a state-funded program to offer benefits, including for services like lactation support, to those who are excluded from Medicaid and Child Health Plan Plus based on their immigration status. While this policy change might not benefit a huge number of folks in Colorado, it's a really significant step. Few states have made this kind of decision to guarantee coverage for undocumented people. And it sends a message, I think, about the importance of access to healthcare for these groups. And there was a big coalition behind this bill. Next is House Bill 1295. This creates another new department, this time for early childhood. The department is charged with enacting one of Governor Polis's signature efforts, which is free preschool for all Colorado children. In addition to universal preschool, the department will oversee everything from childcare licensing and family resource centers to the Colorado Shines quality rating program and the nurse home visitor program. So it's a lot that's going to be handled by this department. In tandem with this legislation, bipartisan bills created a tax credit for early childhood educators and tax exemption for childcare centers, both of which have really struggled during the pandemic. Moving on to talk about systems of care now. The many systems that we as Coloradans rely on for our well-being, from primary care to food access and other social supports, are often siloed or unnavigable, as we know. Incentives for healthcare providers still tend to focus on volume over value, and our battered healthcare workforce needs major reinforcements at this point. So this calls for all sorts of improvements to our systems of care. Legislators provided more resources through grant programs and established new requirements for value-based payments, which are all in service of these kind of improvements. House Bill 1302 creates a new grant program within HCPF, funded by more than $30 million from ARPA, that's going to support physical and behavioral healthcare providers. Grants can be used for efforts like new outpatient healthcare infrastructure and early behavioral health interventions. This bill also funds, for example, a workforce program out at CU's School of Medicine. And House Bill 1325 is really wonky, making it probably a great fit for a lot of folks on this webinar. It requires various state partners, such as the Division of Insurance and representatives from the Primary Care Payment Reform Collaborative, to create and evaluate rules around value-based payments in health insurance. So this includes things like establishing an aligned approach and consistent quality measures for both public and private payers. There were other related bills with millions in additional ARPA funding to do things like improve care coordination infrastructure and improve electronic benefit management systems for things like food and energy assistance. So all sorts of important goals there. And our healthcare system doesn't exist without a healthcare workforce. Given the challenges that have been exposed and exacerbated by the pandemic, legislators chose to pour funding into supports for the healthcare workforce through a pretty large group of bills actually in 2022. Those included successful efforts to assist graduates of international medical programs who come here to practice, increase the number of higher education tracks specifically for rural providers, prioritize nurse staffing at hospitals, and ease the process of interstate licensure for counselors so they can see folks, for example, through telemedicine services across state lines. There were also several bills focused on helping older adults that I think is really important to note. The two largest bills related to our healthcare workforce were Senate Bills 181 and 226. Together, these allocated more than $130 million in funding. Senate Bill 181 charges the new Behavioral Health Administration with quickly enacting a plan to improve the behavioral health workforce in Colorado. It includes funding for the Health Services Corps for student loan repayment and the state community college system, as well as an emphasis on expanding the number of peer support professionals, for example. Senate Bill 226 addresses essentially the entire rest of the healthcare workforce. It funds education, training, recruitment, and retention efforts for lots of different types of healthcare providers, people like school nurses. The bill creates a new grant program for practice-based training, and it also, I think, interestingly, includes millions of dollars for re-engagement initiatives aimed at healthcare workers with expired licenses. I do want to note here that there were things legislators felt they couldn't responsibly do with one-time ARPA dollars to support healthcare workers, like increasing provider reimbursement rates, which a lot of folks were calling for this year. But given the one-time nature of the funds, legislators kind of felt their hands were tied on some of those things. And Joe will talk more about ARPA decisions later. But these bills really do provide significant resources that I think will be important. Our fourth spotlight is about costs. As in every recent session in Colorado, at least since I've been at the Colorado Health Institute, legislators introduced a range of proposals focused on controlling health costs. However, what I think was different this year was that there was no like one massive program or payment change on the table. So think about all the debates we've had in recent years over creating a public option or the reinsurance program or making changes to the hospital provider fee. This session's efforts didn't grab headlines in the same way, but still successful bills here will have important impacts that I think are worth talking about today. So there was a focus on increasing consumer protections. First of all, House Bill 1284 updates Colorado's surprise medical billing laws to align with a federal act, the No Surprises Act. This law adds protections against balance billing, which is when consumers are asked to pay the difference between the total charges for their medical service and the amount that their insurer agrees to pay. The bill also requires that patients require advance notice of estimated costs before a scheduled medical service. And House Bill 1285 prohibits a hospital from proceeding with debt collection against a patient if the hospital is determined to be out of compliance with more federal laws, this time around price transparency. Starting last year, these laws required hospitals to publicly post their standard charges for different kinds of healthcare services. I think House Bill 1285 flew under the radar for many this year, but it's an example of another stick, essentially, that the state will have to increase transparency in the healthcare system. There was some talk about prescription drugs this year, though notably less than in recent sessions. House Bill 1370 was the most notable in this area, I think. The bill requires insurance companies to offer some portion of their plans with a co-payment only structure for prescription meds, which should offer consumers more certainty over their drug costs. It also calls for more analysis of how prescription drug rebate savings are being passed along to consumers, or maybe are not being passed along as much as they should be, and prohibits insurers from raising medication costs or from dropping coverage for drugs on a formulary in the middle of a patient's plan year. That wasn't the only conversation about insurance benefits. I spoke earlier, for example, about the Cover All Coloradans bill that passed. Another bill passed, for example, to increase the availability of medically necessary fertility treatments for some folks. But a bipartisan bill also passed that will require evaluations of the costs and benefits of future insurance mandate proposals. So Senate Bill 40 creates an actuarial review process that'll be handled by the Division of Insurance. Legislators can request an analysis of up to 6 total bills in the fall before each legislative session, and that analysis will assess their fiscal impacts both 5 and 10 years out from their proposed effective date. So I think this bill comes in response to tensions over the cost of new mandates that have been discussed in recent sessions. Some folks on today may remember, for example, back in 2020, the governor's veto of House Bill 1085 that would have increased required coverage for alternative opioid treatments. Governor Polis at that point cited concerns over the impact it might have on private insurance costs. And so this bill acknowledges, I think, that type of hesitation. And fifth is about public health. Public health has faced an onslaught of challenges, as we well know, 2+ years of a global pandemic, public skepticism, threats of violence and doxing of public health workers, all of this on top of the chronic issues of underfunding public health priorities and the challenge of effectively communicating the impact of things that never happen. So this is a tough field in addition to a really important one. This year could have been better for public health in Colorado. It also could have been worse. Public health played some pretty successful defense in the legislature, for example, against bills to lessen the impact of public health orders or to ban employers from requiring COVID vaccines. Perhaps the biggest gains, interestingly, for public health actually came on the environmental health front this year, especially on the subject of air quality. So Senate Bill 193 creates several grant programs to fund voluntary efforts to reduce air pollution. This includes grants for reducing emissions from industrial and manufacturing operations, supporting bike share programs, and encouraging the conversion to electric powered school buses. There was also a big increase in next year's state budget for more monitoring and action on air quality, including approval for dozens of new state staffers. Note that in the past, Governor Polis has had some disagreements with this party over environmental policy changes, so we'll be watching to see if everything that's passed is signed into law. There were also setbacks for public health, though, this year. I have already talked about the disappointment many advocates felt over the criminalization piece of House Bill 1326, the fentanyl bill. Another public health setback came with regards to vaping. So House Bill 1064 would have banned the sale and marketing of all flavored nicotine and tobacco, including vape products that are incredibly popular among Colorado's youth. It would also have created a grant program to provide resources to groups that have been disproportionately impacted by these products, particularly Black and Latino communities. The bill was named right toward the beginning of the session as a public health priority, and it did pass out of the House, only to then fail in the Senate on the second to last day of the session. Governor Polis had publicly threatened to veto the bill ahead of that decision, and perhaps because of that looming threat, in addition to the fact that that bill would have undoubtedly taken a lot of time for debate on the floor as the clock was winding down and lots of other stuff was undecided, given all that, it died in committee with bipartisan opposition. I think that this was an example of Senate leadership essentially choosing their battles in the same way that proponents advanced some public health priorities and harm reduction priorities in the fentanyl bill while letting others go. So the result was kind of a mixed bag for public health this year. And quickly, a bonus, I wanted to acknowledge one more area, which is a growing focus on climate preparedness and resiliency efforts. While there were many bills this session related to environmental issues, from air quality, like I just mentioned, to more oil and gas regulations, there wasn't as much talk about climate change, but we expect that this will increase specifically in sessions to come. CHI is prioritizing support for communities to adapt to a climate that is undeniably warming and that will disproportionately impact lower income individuals and communities of color. And so notably, I think this year, Senate Bill 206 establishes new programs and creates an office for addressing climate change in the state. The Office of Climate Preparedness will develop and implement a statewide roadmap to identify strategies focused on climate mitigation, adaptation, conservation efforts, resiliency, and recovery. That's a mouthful, but it's all really needed. And so this plan will be updated every 3 years. And it's just a reflection of how immense the challenge of our changing climate is. So keep an eye on this topic going forward. Just to wrap up this section before I hand it back over to Joe, I want to acknowledge that there will be big changes ahead in 2023 in terms of the makeup of our legislature. Between term limits and shifts due to redistricting, about a quarter of the seats in the legislature will be held by different people when work begins again next January. So the elected officials will look pretty different, but I expect that these topics that I just walked through will continue to be among the top storylines that we'll be following. So I will hand it back to Joe now for a deeper dive into the impact of ARPA funds on legislative decisions this year.
All right, thanks so much, Allie. As Allie said, to wrap up today, we're going to look in detail at the choices Colorado legislators made with the $3.8 billion they got from purview over in ARPA. Now, the most direct way to spend that money would be to cut every Coloradan a check for $658.23. Well, that would be nice to get a check like that. It probably wouldn't change too many people's lives. Even with a sum like $3.8 billion, it is possible to diffuse it out in a way that it just doesn't make that much of a long-term difference. But $3.8 billion is still a lot of money, and there's a powerful urge to do something transformational. So the question to keep in mind as we look at the next graphics and as we go into Q&A in 2 or 3 minutes here is to will these appropriations be transformational? So let's take a look at what Colorado legislators did. Oops, having some technology issues here. There we go. So one of the things we always strive to do at CHI is to help people see the big picture, to bring order to chaos. And ARPA is a place where there's a huge potential for chaos. There are literally hundreds of entities in Colorado that are receiving funding from this. So you might remember last year when we produced this financial map, we traced about $10 billion that went to public entities in Colorado. But it's a lot to look at. We call it the rainbow spaghetti diagram here at CHI. So we knew we had to do something different to be able to capture the details of 2022's legislation. So this is the rainbow spaghetti diagram, but mapped into a rainbow donut. Big improvement in terms of food tastiness, I think. You can see, big picture, there's the $10 billion that came into public entities. There's $1 billion for schools. There's another $2 billion for local governments. And then there's more than half of it went directly to the state, although not necessarily through the state legislature. Here you see $500 million for home and community-based services in HCBUF, almost that much in childcare grants. What we're focusing on in this presentation is the legislature's set of money. It had, again, $3.8 billion. It set aside more than about $1.2 billion last year for transportation, allocation to the governor, and then 5 different pots of money, some of which was spent last year, and some which is left for what was left for 2023. And that's where we begin or 2022. That's where we begin the 2022 session. This discretionary pot, if you're a legislative wonk, is the Revenue Loss Restoration Cash Fund. And under federal rules, legislators had nearly unlimited control over how they could spend that. They put most of that $600 million in the closing dates of the session into the revenue law, into the unemployment insurance fund. It increases some benefits and makes it easier to apply for unemployment, but mostly it pays back deficit in the fund, which avoids increasing payroll taxes on businesses. Then you see about near 450 million or so in housing, mostly through grants to locals and local governments and a revolving loan fund. What we're going to focus on here is behavioral health. That's a priority for CHI, and I assume for most people on this call. One of the major problems in behavioral health is that when children or adults have a mental health or substance use crisis, they don't have a proper place to go. So they often end up in the emergency room, in jail, on the streets, just back at home. So the legislature's spending more than $110 million to increase youth and adult beds in the system. That should help a lot of people. However, I haven't heard anyone claim it's going to be sufficient to solve our access problems. There's also a large pool of money available for local governments to apply for grants to expand their array of services. There's 72 million to retain and recruit a bigger behavioral health workforce. And then there's $35 million for integrating behavioral health and primary care, which Ali had talked about this. And this effort really got going in earnest back in the Obama administration with a state innovation model and an award of like $66 million or something like that to Colorado. At the time, that $66 million was a really big deal, and it was the biggest game in town in health policy in Colorado for a few years. So that gives you a little bit of context and scope of what's available now and the big changes that are going to be ahead. Now, I can almost feel, clicking on your screens, wanting to like open up some slice of this donut. We are going to publish this on our website. It's not quite ready. We have a little bit of work to do on the back end before I want to publish it. But if you're registered for this webinar, we'll make sure you're the first to know when it's ready. So let's go with that. Let's go now to you and see what you have to say. Before I throw it to Christy for some questions, let me just queue up a few. How would you characterize the 2022 session? Are these federal funds going to be transformational? What should be on the agenda for 2023? So I will toss it over to Christy, and she has actually a quick break to give to announce the winner of our breakfast giveaway.
Thank you, Joe. And while we let folks type their questions into the Q&A box, we did a drawing this morning with everybody who registered for today's event, and Danielle Descharteau was the randomly selected winner. We'll be emailing you, Danielle, and we'll arrange to deliver breakfast to your office. So happy Egg Month. And with that, I will move over to the Q&A. Right now, we don't have any open questions. So I'll give folks just another minute or two to type in their questions and comments.
Don't be shy, folks, and we really are interested in your take on the ARPA funding. I know it's early to render a judgment, but this was a historic moment in Colorado, and continues to be a historic moment. So really want to see what you have to say about it.
All right, we have our first question here from Stephanie Glover. Oh, and Stephanie, it looks like you are, I almost feel like we may have planted you here. Stephanie, can you raise your hand? We'd love to unmute you and see if we can answer your question live. All right, Stephanie, we are unmuting you. Can you share your question? And thanks for joining us this morning.
Yeah, of course. Happy to join you. Of course, just as I came off of mute, my dog is barking in the background. So apologies for that. I was just curious if you guys have any very early predictions around legislative issues for next year. I know we're all still recovering from this legislative session, but just curious.
Stephanie, your dog just made my morning. Thank you for sharing that with us, truly.
Okay, great.
I'm happy to start and we'll let Joe weigh in as well. So I think, we touched on this a little bit at the end of the second section of our presentation, but I think a lot of the issues that we profiled this year will continue to be a big deal. Behavioral health seems like it has really just risen to the top in recent years, and I don't see that changing. To Joe's point, there was a lot of important funding, but it's not going to solve the problem, right? It's not enough. I think that housing is another one of those issues. Housing is something that we have increasingly seen highlighted as a direct correlate for health outcomes, right? I think that a number of years ago that maybe wasn't the case as much, and now folks really seem to have agreed that housing is an important driver of health. And so I think that those two will continue to factor. I think given the vaping bill that failed, that is certainly going to come back. There's going to continue to be this conversation about nicotine and tobacco products, about use by kids, about whether that's a local or state control issue, for example. And so those are a few of the things that I would expect to see. And then there will be a bunch of new folks in the legislature. So who knows what their priorities will be. Joe, what would you add to that?
Yeah, to that point, there is going to be an election, and that will determine what will get done. That usually the year after an election is more active for policymaking. So this is Democrats are heading into a very tough environment for the November election. The midterm is always punishing on the party that holds the White House. With inflation so high this year, it probably will be again. So this represents the best chance Republicans have to reclaim one of the chambers in quite some time. On the other hand, if they can't, and if Colorado Democrats can survive this really tough national environment, that to me, and probably to them, would say, if we can get through this, we can get through anything. Colorado is a blue state, and let's be off to the races. Second point is the legislature just put an extra couple billion new dollars out into the system, and that is going to take follow-up. It's never so simple as passing a bill and winding it up and letting it go. There's always follow-up legislation that's needed. So no matter who's in charge, things that you saw this year, we're probably going to be honing the details on next year and for several years, actually.
We've got a quiet group this morning. Any other? Oh, here we go. I've got an anonymous attendee, so I am not sure I'm going to be able to. If an anonymous attendee, if you would like to raise your hand, we can unmute you. I'll give it just a tick. Otherwise, I'll go ahead and read the question here. All right. All right. Will that quote actuarial review bill SB 040 serve to reduce bills introduced?
Yeah, it's a really good question. So Senate Bill 40, again, is the one that allows legislators to request this review in addition, or in advance, excuse me, of the session for up to 6 total bills that would create new insurance mandates. I don't know if that will reduce the number of mandate proposals that are considered, but it could. I think something that I'm not clear on, and I'm not sure if the legislation clarified this or not, is if all mandate proposals have to go through that review process, or if it is something that maybe will like help a bill, right? You get a gold star if you've done the review and you have the additional information to share. I'm not quite familiar enough with that legislation. It's possible that somebody on the call today knows. But if that's the case, right, that mandate bills have to go through that review process, and the fiscal note, I believe it was the final version, that limits that number of bills to 6, then potentially yes. But I think we're going to continue to see some wrestling over this question of cost and benefit with these new bills. So great question, and TBD.
Yeah, I think probably the intent of it would be to weed out some mandates. This is something that the insurance industry has pushed for a while, and the long-running dynamic is that Colorado legislators historically of both parties have not been too shy about increasing mandates on insurance coverage and the individual and small group market. And that's because it's usually a mandate that covers a small group of people who really need something. So, or a small-ish group of people. So, think about like a mandate to cover autism spectrum disorders. It's going to be a big help for a very passionate community that is there at the Capitol lobbying for it. And let's say it increases the cost of a typical insurance policy by, I'm just totally making this up, by like $10 a year. That does not inspire an equally big community to fight against it. So that's the dynamic this bill is trying to alter a little bit by bringing to light what a mandate would cost. Not to say that it's not something we should pay, because we can always do a lot better in this country at taking care of people and their health needs and fulfilling that social contract.
Yeah, thanks, Joe. And maybe one other quick thing I'll just mention that's interesting about this bill is that bill was introduced and failed in 2021, and I think came back this year with the same bipartisan co-sponsors and passed this year. So I think that there has been a fair amount of background conversation with folks at the state and with legislators about the intent of that law, but it was interesting to see it return this year and pass. So.
All right, we don't have any more questions in the queue, and we're getting close to time. So Joe and Allie, I'll kick it to you to take things home.
All right, well, thanks so much for joining us. This is our monthly webinar. I see so many familiar names on the call, so thanks for being repeat customers. Keep your eyes on your email for our notice about our next month's webinar, and also the recording of today. That'll be posted probably later today. We'll have a follow-up email that goes out by the end of the week. And then if you were interested in those graphics, or like my awesome Photoshop skills on the check picture, definitely get in touch with us, and we will be posting not my Photoshop seminar on how to do that, but we will be posting the interactive graphics, which fairly soon here. So keep an eye on that too. Have a good day, everybody.
Happy Thursday.